Good evening and welcome to another episode of the Healing Lyme Summit. I'm your host, Dr. Mariah Hinchy, and tonight we're going to talk about a very important topic: how to know if your treatment is actually working. Most people have heard that you tend to feel a little to a lot worse before you start to feel better when treating tick-borne disease, and it's super important to be able to tell if you're having an allergic reaction to your medication, if your treatment plan simply isn't working, or if you're having the dreaded Herxheimer reaction. So, here to help us navigate through it all is Casey Kelly, MD. Welcome, Dr. Kelly. Tell us a little bit about yourself and how you got into specializing in treating tick-borne disease.
Thanks for having me. Yeah, my journey is pretty personal. I think that a lot of people get into treating Lyme due to their own health issues or that of one of their loved ones. I was sick for about probably 15 years with multiple different diagnoses before I really got diagnosed with tick-borne infections, including things like asthma and POTS and a whole bunch of fun stuff. And in that process and journey, I started to look for it in my patients. And when you start to look for it, you can't stop looking for it because you keep finding it. And in that process of being able to help myself and help other people through this journey, it's just really developed my career around trying to help these chronic complex illnesses in patients. And I'm really enjoying the journey.
That's wonderful. Yeah, when you're acting as a functional medicine doctor and you're looking for that underlying cause, it's if it's there, you absolutely have to address it. So let's jump right in. What would you consider to be the most common indicators that a previous treatment plan did not work?
So I typically go mostly by symptoms. I think Lyme and chronic infections are still mostly a clinical diagnosis. So the labs can be very helpful and it's worth checking them, especially if there's red flags in the history that make you want to look for it. But we still have to really take a good history and try to figure this out. So if a patient has done a treatment prior to coming to see me, or if they're in the process of working with me and they're not getting any better whatsoever, they are getting worse and continuing to progress. Those are big key signs that the treatment is not working. And sometimes these are subtle. Like sometimes we feel like we're not getting better, even though we are, because it's so subtle in our day-to-day lives that we don't necessarily see it. Kind of like when you see a little baby and you only see that baby every 3 months, they look huge the next time you
Mhm.
see them. But the mom thinks that they're, not much different because they're seeing them every day. So it's really important to kind of dig in and figure that out. Are your symptoms better? Are they different? Where are they? But if they are not any better whatsoever, if they are getting worse, that always requires us to go back and take a deep dive and say, is this treatment working? Is there something we're missing? What's going on here? What do we need to be doing to fix this?
Right. And so, how would you differentiate between whether a patient was feeling worse because of having a Herxheimer reaction, not properly detoxifying, or if the treatment plan isn't working?
It's a great question. We get asked this all the time. First and foremost is the question I will ask back is, what have you done to try to help support your Herxheimer reaction? Is it because as a doctor, when you sound these things, the way I describe a Herxheimer is it's typically your symptoms, but worse, or it's like the worst flu/hangover you've had,
Mm.
you know? And so if any of those things are kind of flaring up and some people are having those symptoms, my first question is, what have you done from our HERC support handouts and information that we've given you? Because if it's a Herxheimer reaction, generally speaking, one or two or three of the tricks that we have for Herxheimer support will help at least take the edge off of the symptoms. And if it can take the edge off the symptoms and make everything a little easier, that's a really telltale sign that this is a Herxheimer reaction. And we can feel a little bit better that that's probably what's going on. If they've tried a bunch of Herxheimer supportive therapies and nothing is working and they continue to get worse, that's a sign that this is not the right treatment for them. The other sign, some other signs that we look for too is if they like an allergic reaction. So if this medication or if this treatment is causing a side effect, and that's the tricky part, is trying to figure out side effect versus Herxheimer reaction. So certain medications can be very hard on the gut for example. Like doxycycline can cause ulcerations in the gut mucosa. So if someone is having acid reflux GI symptoms, it may actually be a side effect of the medication. So we have to figure that out in the history and exam to try to see if it's an actual side effect from the medication versus a Herxheimer reaction. It's tricky. A lot of it, there's not a lab test that will tell us side effect versus Herx or fail versus Herx, so we have to really think through it and parcel through it and talk it out.
Right. And on the flip side, are there signs or milestones that you would look for to get clues that the treatment is moving in the right direction or that it is working?
So because each patient is so different and unique, I don't have set milestones that I'm looking at because some patients are going to come in so debilitated that they can't walk. Some patients are working every day still, so it's very different. So we can't necessarily have these flags in the sand. So we have to take each patient individually. And again, it's more based on your symptoms and your symptomatology. So the ways to do that are to help figure out a really good clinical history and have a really good inquisitive provider asking the right questions to figure that out. There are different questionnaires that you could fill out as well. Dr. Horowitz has one, the MSIDS questionnaire. If the Functional Medicine Institute has the MSQ or medical symptom questionnaire. So there are a couple different ways out there that way as well that you can kind of judge for yourself and periodically do and see how you're feeling that way to see if things are improving. I do use labs. I have certain labs that I will use to try to kind of gauge what the immune system's doing, how it's responding. Those are tools, that we can put together with the history to see if patients are getting better. I also really like to ask patients what are their goals and what is better to them. Because it's not good enough to just say, I want to feel better, because that's different for everybody, again, right? So somebody who used to be a triathlete, their goal may be that they want to be able to do another triathlon. That is not my goal. That is not what I want to be doing to have my health goal personally. I have some people who love reading and they really want to be able to read a book again without having to reread every sentence to try to get what's actually happening in the plot. So being able to kind of really think through as a patient, what are the things that I can't do right now that I want to do, and how do I get there? That helps us as the providers to kind of gauge where you are on that. And we can also help kind of refine some of those goals and get to some earlier benchmarks for the patient individually to figure that out. And I think that's important to think about when you're going through all of these things and you feel so horrible. Like, what do I need to do? What I want to do next that I can't do right now? And then what's the next thing that I want to do? So a couple different ways.
Yeah. It's funny because I always say to patients, it's important for me to document how many symptoms you have overall, what the severity is on a scale of 1 to 10, what the frequency is on a weekly basis. Because if you come in and you're having a terrible day, you're going to tell me that you don't feel any better. And if you actually are having a good day, and the symptoms of these diseases are so intermittent and all over the place, you're going to say you're feeling so much better. So, for me, it's helpful to actually track the severity, the frequency, and the sheer number of their symptoms and watch those sort of resolve over a period of time. Do you ever do that in your practice?
Yeah, absolutely. And this is kind of what I was alluding to earlier too. So for example, like you may feel like you're not feeling any better. And let's say fatigue is one of your biggest symptoms. And you're like, I still feel just as tired at the end of the day as I did before. But when we
Mhm.
start to dig through it, you're actually doing more in that day. You're able to go to the grocery store and do laundry that day when you
Yes.
could barely take a shower the day before or the month before or what have you. And so you may feel just as tired at the end of the day as you did originally, but you're doing so much more, and that's improvement. That's improvement too. So like there are different ways to gauge these reactions that people have. The one caveat I will say to this though is there are certain people, and we can all fall victim to this, where you become really obsessed almost with those symptoms.
Yeah.
And so we want to make sure we're monitoring them, but not be so hyper focused on them that we are missing the forest for the trees as well. So if we're that type of person that like, kind of latches onto that, we've got to be able to also distance ourselves so that we can live our lives and really try to get fulfillment and healing from this journey too, and not be quite so honed in on every particular specific little tiny symptom as a
Yeah.
part of this, because it does change so much and there's so many things going on that can take your whole day if
Yeah.
that's what you're doing. Right?
Yeah. Yeah.
Yeah.
I tell people, I'm like, do the evaluation when I see you every 4 to 8 weeks and try to just go on autopilot and try to live your life and focus on, being positive and nurturing yourself in the time in between. Um, And I don't know why, but I always tell people try to stay out of those chat groups because a lot of them can be more stress provoking than help, unfortunately. But you
Yeah.
had mentioned, there are some tests that you would look at to evaluate like immune system response. What markers would you actually be looking at to kind of gauge some successful progress?
So I look at a handful of different things really to monitor over time and look for changes, and also to look for patterns, because there's
Hmm.
certain patterns that might highlight some of the other issues going on, maybe mold versus parasites or something else. None of the labs that I use are necessarily diagnostic of any
Hmm.
one thing. So just because you have a low level of this or high level of that does not mean that you have Lyme. But it's a way for us to gauge all the different moving pieces parts of the immune system, because these infections, they're so smart and they really do alter your immune system, which is part of why we feel so crummy when we have them. So I look at things like the CD57, which is a natural killer cell. I'll look at TGF beta, or transforming growth factor beta, C4A, C3A. I'll do a CBC count, which is a white and red blood cell and complete blood count. Metabolic panel looking at kidney, liver functions, some electrolyte panels, and a handful of others, just kind of depending on what the symptoms may be. We can look at Epstein-Barr levels, we can look at Candida levels, we can look at ECP, which can be a marker of parasites or allergies. And of course, we'll look at Western blots and DNA testing and other things for infections along the way as well. But I like to get a baseline when you first come in, so I can see where you are. And then what I'm looking for are trends for these. And they also help kind of support different supplement support that
Hmm.
we can give to patients too, that might help to balance the immune system in the different ways that it's off. Those are just, they're tools. They're tools in your toolbox, but you can't use them as a black and white, this means that kind of thing.
Right.
Yeah.
Right. As you said, it's a clinical diagnosis and a lot of, in my opinion, looking at whether the treatment is working or not working comes back to the changes in the clinical presentation. So yeah. Okay. So what would you say are the most common pitfalls to successful treatment? It's a big
And this
question.
is, yeah. And this is, I think, where an integrative and functional medicine approach to these is so necessary, because often, especially with chronic Lyme or chronic vector-borne infections, there's so many other moving pieces parts. It's not just one thing that's happening in the system. And so if there's a plateau in your symptom relief, if you're not getting where we want to get, if we're not responding at all, or if some of your original symptoms are better, but now you've got some new stuff showing up, we've kind of gone down a layer, if you will, in your symptoms, we have to look at where the roadblocks and hiccups are. And some of the big ones that show up are mold toxicity,
Hmm.
mast cell dysfunction, other co-infections that were missed, or parasites that have been missed. I think one of the biggest things overall that can really hinder healing is limbic system and vagus nerve system disrepair, and our brain's ability to think it's helping and send out all of this constant inflammation. And it just becomes really hard to fight against that to really heal and get better. And there are ways to work through that and process that, but that is a big part of the journey for a lot of patients, is to work through that and repair that. That's a big, big hiccup, I think, that often gets missed.
Yeah, I agree. What are some of your favorite, maybe just your favorite therapy that you like to recommend to patients to deal with that?
Yeah, so I mean, I have a big handout with multiple different things on there because everyone is so different, and I want people to start where they need to start with these things. Um, I generally, though, am not recommending diving right into trauma work on the first
Mhm.
day. It's much more vagus nerve and foundational work for the nervous system. I think there's some really great programs out there that will walk patients through these step by step. Primal Trust is one of my favorites, but there's others out there as well.
Mhm.
There are wearable devices or other devices for vagus nerve stimulation and calming. Um, there are also, binaural beats that people can listen to. You can gargle and sing. That also helps your vagus nerve. Heart rate variability support. There's a lot of books out there that I will recommend for people, and I can go into details if you want me to, but there's so many different options, and there's different ways to approach that healing that I often try to give patients a handful of options so they can
Mhm.
see what makes sense to them. Because not everyone's going to be able to start a big program from the get-go, but they could do 5 minutes a day of binaural beats or something a little more simple to get them started and then build upon that over time.
Yeah, that's great. Um, let's see. Are there any In your opinion, are there any sort of risks associated with continuing working a treatment plan that is ineffective?
Well, I mean, there's definitely risk to the pocketbook if you're spending a lot of money on things and it's not getting you where you want to go. And if
Yeah.
we're using things like prescription antibiotics, we also run the risk of really disrupting the gut and creating dysbiosis or even C. difficile infections in the gut if we're kind of hammering away at prescriptions that aren't working. So there
Mhm.
definitely are pitfalls to it. There's plenty of herbs and things that are pretty safe and benign, and so it's not necessarily going to hurt you to be on it. But if it's not helping you, that's like one more pill that you have to pay for and take and swallow,
Right.
right? And then, you can always end up with an allergic reaction or some sort of bad side effect from a treatment that's working or
Mhm.
not working, right? So
Mhm.
we do need to be very mindful and appreciate that and not miss
Yeah.
it.
Do you have any advice to a patient that might be struggling thinking that their plan isn't working?
Yeah, I think you have to advocate for yourself. Even with Lyme literate providers who know these, you know your body better than anybody, and you're living in it every day.
Mhm.
And if it doesn't feel right to you, you have to advocate for that and say, this doesn't feel like it's working. This may be a herx, you're telling me it's this or that, but this doesn't feel good. I really want to try something different. I think that that's fair to have that conversation. You should have a partnership with your provider. And so as the patient, if you don't feel comfortable, speak up.
Yeah, absolutely.
Okay.
Um, Anything else, like what would be your number one tip or advice to a patient that's new who thinks that they have a tick-borne disease or is newly diagnosed and just doesn't really know where to start?
Yeah, this goes back to your own self-advocacy again. You really have to look for that provider who's going to be the right person who's going to listen to you. And if you meet with somebody and it doesn't feel like a good fit, you got to go somewhere else and keep looking for that person who's going to hear you and work with you to help create a treatment plan. But you need to educate yourself and you need to really learn about what these things can do. And, if you've already kind of done enough of the research where you think that that may be what's happening, you need to find a provider who's going to test you for it and test you for it with the good tests, the reliable tests. Even though our tests are still gray at best, sometimes, being able to find the providers who can at least hone in on the better ones that are available out there and really start to take that information and take a deep dive for you. ILADS is where I would always start, ilads.org. That's where we train providers to treat these infections. And so you can start there by looking for a provider who has that education and that background. And we're all over the place. So you should be able to find someone hopefully close enough to you to at least get started.
Yeah, iLads is a wonderful organization. It is where luckily I wound up when I started this whole journey, my gosh, like 15 years ago. And all of the providers there that are involved in the organization itself is just invaluable. So ilads.org, ILADS.org. Very, very valuable resource. Do you want to share maybe your top two or three favorite, whether they're prescriptions, herbals, self-care, detox, what is your go-to when you're trying to help someone decipher, whether they are feeling absolutely terrible because of herxing or, if it's just that their plan isn't working? Like how do you start? How do you dive into that? How do you figure it out?
So yeah, I have a great handout that I give to people to get and give them a roadmap for where to go from that. And the two kind of big caveats that I think about are one, increase and support detox. Make sure you're flushing out the toxins and clearing that out. And two is lowering inflammation. And they're pretty similar. They kind of go hand in hand. But those two, if we can kind of focus on one or both of those, we'll typically see some improvements. I really enjoy SPM active or other SPMs or specialized pro-resolving mediators that clear out inflammation that's already there. Like if we're herxing, we're probably inflamed. So
Mhm.
this is a from fish oil product that will help flush out the inflammation. I also really like Berber Panella, which is an herbal drop from Nutrimetics that's great for neurological herxing, so fatigue, brain fog, irritability, mood issues, where people can take, I mean, you can take 20 drops 8 times a day to help really
Mhm.
kind of calm all of that. I have a little detox lemonade that I also like. This works great in kids too. Um, it is anywhere from a teaspoon to a tablespoon or so of baking soda, juice of half a lemon, and then a couple drops of stevia. And it's very alkalizing, supportive drink. And like I said, kids usually will drink this. You can make it so that the kids will drink it, which is nice because it's hard to get pills and things in the kiddos. But we get very acidic when we're herxing too, and this helps to alkalize the system and kind of calm things down. And it's, simple stuff that we can find in our cabinet. So we don't have to go buy a whole bunch of stuff. So those are just a couple little tips to help support herxing. And like I said, if it takes the edge off, it may not clear up the herx entirely, but if it takes you from an 8 to a 6 or an 8 to a 4, we're making progress.
Yeah. So if you have a patient that is herxing, do you typically add in these supportive cares and have them kind of push through with their treatment protocol, or would you say you err more on the side of like decreasing the dose, or do you pause the treatment? Because I've talked to so many practitioners that, and we typically seem to fall in one or the other category where we're like, okay, suck it up, push through, get through it, and do all of the supportive care, or, we tend to like stop, try to detox, deal with the inflammation, and then move forward. Where do you fall?
Yeah, this is some of the art of
Yep.
medicine. I fall on I'm okay with you being uncomfortable, I guess. And I always like, okay is not even the right word, but I can deal with uncomfortable. I can deal with manageable. But if it's so unmanageable that you cannot get out of bed, you cannot function, you cannot live your life, that's too much.
Yeah.
That can often, for me as a provider, create more of a mess for me to
Mm.
pick up and clean up afterwards. To try to put everything back together, that I don't find it worth it to go push quite that hard. So that's where I find herbal treatments are sometimes beneficial because you can kind of tailor that much easier to the patient. You can increase slower, you can stop a little bit, you can go a little more at their pace versus antibiotics, which are, most of the time, here's your dose, good luck.
Right, it's like you
See what
can't really
happens.
alter the dose of an
Yeah.
antibiotic, yeah.
Yeah.
I tend to fall in the same camp as you with the kind of like, as long as you can function, get through it. And it's funny, until I was putting together a talk on like the pathophysiology of a herx, I kind of just was like, it's okay, it's a temporary worsening, you feel worse, push through. And then when I started looking at like chemically, biochemically, what a herx actually does and is in the body, I was like, oh wow. Like we're really pushing like all of those inflammatory cytokines, and the body becomes so overburdened with toxins. And I was like, wow, I mean, if someone doesn't turn around, in my opinion, within a couple days, I'm really starting to pump the brakes, which is something that for like a decade I didn't do, because I was like, wow, like I'm actually increasing inflammation, toxicity, oxidative stress, which from my own theory is making the patient, more hospitable and actually feeding the infection. So it's just so funny, right? Like the longer you practice and the more you learn, like the more you learn.
Yeah.
So,
Yeah.
yeah, but I've always been one of those, as long as you can handle it, like suck it up and push through. So it's just, it's interesting, but
Mhm.
I love all of the therapies, that you mentioned.
Yeah. And those are just a handful. I mean, there's so many different ones too. And what works for one person may not work for another person. That doesn't necessarily mean it's not a herx. Just means we
Right.
have to find the right tool to help you get through stuff and help your symptoms.
Right. And I think, from Dr. Horowitz, right? Like the main components are supporting detox, dealing with the inflammatory cytokine cascade, and alkalinizing the body, right? Those are the big three components. Obviously using
Usually one
binders.
or all three. Yeah,
Yeah.
we'll help take that edge off. But yeah, I agree that, and we've learned so much too as a world as a whole with the cytokine storm, thanks to this
Yes.
recent pandemic that we all just went through.
Uh-huh.
And it feeds like us, us Lyme docs, we've known this for a long time. And
Yeah.
that's what this is. And so we have to manage it and yeah, do it in a way that isn't going to create more problems, as you
Right.
mentioned. Yep.
And God forbid the spike protein, whether it's, from the vaccine or from getting COVID, that to me, is just like throwing a whole stick of dynamite into the whole, tick-borne disease and infections. It just
Yeah.
really exacerbates things for quite some time. I see in almost every single patient.
Oh yeah, it can, and it's highlighted patients who didn't know they had tick-borne infections.
Yes.
Yeah, that's where we're finding a lot of them, post-COVID,
Yep.
and now they're positive for vector-borne infections because it was just hiding under the surface.
Yeah. I had a really interesting talk with Dr. Bill Rawls last night, actually, about all of these dormant microbes in the body, and how, something comes along and it's like the straw that breaks the camel's back. And then all these microbes that were being controlled by the immune system just go on this feeding frenzy. And that's it. You have like this full blown onslaught of symptoms.
Yeah, it's exactly. Yeah, and that's what we're seeing with a lot of our long hauler patients. I literally have one long hauler patient who did not test positive for a vector-borne infection.
Wow.
One.
Wow. That's
And
crazy.
I'm, you know, want to repeat that testing just to confirm that
Yeah, right.
it's so negative.
Wow. So,
Yeah.
Casey, anything that you would like to have our listeners hear or share with our listeners before we conclude our interview today?
I think one of the most important things to remember, especially even if we're, just Lyme in general, but talking about too, is this working? Is this not working? Where am I with this? Is to really remember that these are marathon treatments. This is not a sprint. If this were so easy where I could just give you 2 weeks of a medication and be done with it, my life would be so much easier,
Oh, yeah.
you know? But it's not that. There's so many layers to this, especially if you've been sick for a long time, that we really have to be able to spend time to get through that. And the patient's aspect of it is really difficult. And it's difficult from the patient aspect, but also the provider. We want to get you better as soon as possible too. It's not easy for us as the provider when things are moving slow. We're on your team when we want things to move faster too, but sometimes we can't go faster for multiple reasons, or there's all these hidden roadblocks that we have to uncover. So I think the important thing to look at is to, look at those small goals and work your way through that and give yourself grace as you're going through this process, and appreciate the wins and appreciate the victories that you are getting, and being able to look back and be like, I couldn't have done that last year. This is better. We're working through this. We sometimes have to remind ourselves of that because we're not where we want to be, or we're not better, but we are. And it's that reminder to get through that process. In our practice, we actually have a disco ball when people get their lives back. We have a disco ball from the ceiling. We put on some disco music. We take pictures. They get a disco ball. We get to put a pin on the map and a disco ball, because we really have to celebrate those victories and those wins when people really start to be able to get their life back. And that doesn't necessarily mean that they're perfect or they're in remission or their labs are normal, but they're able to do the things they want to do again. And they've gotten their life back. And that is huge. And, these chronic infections are our daily reminder that we have to take care of ourselves. We have to eat well, we have to sleep well, we have to stress well, right? And, don't let it be a bad identity, let it be a good identity. Yeah, I am a survivor of these infections. They're probably still in me. We've made peace. We're buddies. We're friends now. Everything is great. We're going to move on and go on and enjoy our life, but it can take a really long time to get to that spot. And that's okay. Give it its time, let your body work through it, and really appreciate and love your system and your immune system and your body for what it's doing for you.
That is amazing advice and very, very much needed. I think everybody suffering from these infections needs to hear that. Thank you so much for everything that you do.
Yeah. Well, like I said, I'm a survivor myself. I've been through this, and I think that helps me connect with patients and understand where they are. I've been afraid to stand up because I was afraid I'd pass out with it. But you can come a long way, and you just have to keep putting one foot in front of the other. And it's really my blessing and my joy to be able to help people get to their disco ball.
Yeah, that's awesome. So remind people how and where they can find you.
Yes, I founded Case Integrative Health in 2019. You can find us at caseintegrativehealth.com. We're located in Chicago, Illinois, and actually in Hinsdale, Illinois as well. We have multiple locations. So reach out to us. You can give us a call. You can set up a discovery call through our website, which is free, to see if we're a good fit for you. Check us out on Instagram and Facebook as well, on social media, see what we're up to. And we would love to hear from you.
Thank you so much.